Good evening. And my name is Coleman Good. My pronouns are he, him, they, them. And I'm the manager of community organizing here at the AIDS Foundation of Chicago. I want to welcome you and to thank you for joining us in this space. Building Black Power in the age of COVID-19 is the first of many spaces created to bring the community together and building a network of advocates equipped and prepared for the work. The work we will be doing tonight is just the beginning of many conversations that I hope will lead you to taking community action. Now let's get to our amazing panelists. Panelists, I will start with Brandon. You're on my left. I'll start with you to introduce yourself.
Hello, everyone. Thank you, Coleman, so much for the introduction. My name is Brandon Maurice Wright. I am the program coordinator for the Chicago Black Gay Men's Caucus. I have now been with the caucus for 6 years. That's cool to acknowledge, but also a little bit crazy because I'm like, man, time's flying. But I'm so happy to be here with Coleman and great friends up here on this panel. And thank you for having me. Yes.
Thank you. Let's move over to Mr. Keith Green.
Good afternoon or good evening. I think it's evening now. My name is Keith Green. I'm an assistant professor in the School of Social Work at Loyola University Chicago. I'm also a board member for Chicago Black Gay Men's Caucus, as well as the Weibo Foundation, and a number of other things that I don't have time to go into right now. So I'll pass the mic.
Thank you, Dr. Keith Green. I'm sorry I didn't say doctor. I'll take you now. Let's step over to Mr. Chris Wade.
Good evening, everyone. Good to see everybody. I am Chris Wade. Pronouns are he, him, his. I'm with the Illinois Public Health Association. I am the HIV prevention lead agent and health equity advisor for Illinois Public Health Association. My other time, I'm the health chair for the Peoria branch of the NAACP, and I'm also a member of Alpha Phi Alpha Fraternity Incorporated.
All right, thank you. And next we have Angelina.
Hi, I'm Angelina Nordstrom. I use they, them, theirs. I am the president of the Chicago LGBTQ Worker Center. I also do a lot of organizing with the Chicago Therapy Collective. And I'm also a poet and writer and fierce person, advocate, whatever you want to call it. Everything, I do it fiercely with a passion. Thank you all for having me.
Thank you. Yes, you do. And finally, we have Mr. Randolph Johnson. Oh, you have to unmute, Randolph.
He's saying something good too.
You're muted. There you go.
It asked me, this is my first time doing Zoom. I'm a retired teacher, secretary, but I pretty much a performing artist around town when I can. I used to be with a volunteer at Holy Name Cathedral, and I'm just a senior citizen now.
Thank you so much. Thank you so much. So I'm really grateful to have all these panelists on this call tonight. And I want to kind of get us started in this community agreements for the evening to kind of ground us in this space and the work we're going to do tonight. So some of the agreements I want to put us, and it goes to people that are watching as well who might be asking questions. Remember, this is a safe space, and that assume good intent when questions are being asked or when comments are being made, statements. I want everyone to respect one another and honor the time we have together. I also want people to know there are no wrong questions. So when we ask you to ask questions, there are no wrong questions. And I ask that everyone is present in this space. With a lot of things that are going on in the world, I ask us to spend this next time being present and here with us, and we'll have a great evening. So yesterday was National Black HIV Awareness Day. And that was a day that started in 1999 as a grassroots education and effort to promote HIV treatment and engagement with Black Americans. And this year's theme was We Are in This Together. And that means highlights the importance of social support from friends, families, colleagues, partners when addressing HIV in the Black community. We Are in This Together promotes the idea that we all have a role to play in ending the HIV epidemic. And we must recognize ending the HIV epidemic is a collective effort. Everyone can help reduce HIV stigma and promote access to HIV testing, prevention, and treatment of services in Black communities. So let's get with these questions. This goes out to to everyone. Can you talk about a time you used your power to advocate for change? I'll start with Chris. Can you talk about that?
Yeah, sure. A time I used my power to advocate for change was, I won't mention an agency, but getting an agency to review their policy on collection of data as it relates to the criminalization law. The practice was not supposed to be happening anyway, but recognized that I wasn't about to sign that document, so they would go into certain record keeping. But also, I think my involvement with Illinois ASAP and going to the state Capitol, as well as Washington, D.C., and other vignettes where we talk about the lived experience of HIV with relation to change and our needs. So, yeah, thank you.
Thank you, Chris. What about you, Angelina?
So one great example of using power is being like, I guess, a support system for those who may be apprehensive, I'm sorry, about, even visiting or going to an organization for testing, because there's a lot of stigma that still surrounds, the concept of HIV, the concept of safer sex to begin with. And my contributions have more so been on the ground and with my interactions with community members as like the first person that someone sees when they come into a door of an agency who shall remain nameless. In addition to that, based upon my own experiences with going through the proper training where I could be practicing HIV prevention to this day, I also know that having some of that foundation, despite me not practicing it to this day, is still important because of how important it is to disparage those stigmas and to hopefully normalize this conversation that we're having here among many, so that if someone, contracts HIV, it is not the end of the world, not like it used to be, and to provide a lot more education without there being such a negative cloud, because people are able to live full lives while having that diagnosis. So that's a little something that I have done over the years with my service for the community.
Thank you. I'm also going to throw this over to you, Brandon.
Thank you, Coleman. I really think, of course, all on days work with the caucus, we get a chance to do it in many different ways. I know we'll get into the Prosperity Project later, so I'm going to go back a little bit to, I guess this is me probably talking too much, I don't know, but in high school, I was a part of, I would say a gay support group for LGBTQ students in high school. And I remember it was our first year, literally it started around my senior year. And they wanted to the end of the year, and the halfway mark of having the program, they wanted to open it up as a GSA. And I'm like, no, honey, we need to have this sacred ground right here, right now. And plus some kids just want to get out of class early. No, it's not gonna work. So just kind of having that safeguarding moment, I think, just to kind of just hold the space for my LGBTQ queer constituents that was important for me to have that space for everyone. Since, we were kind of just surrounded by, the opposite when we were going through the hallways at school. So I guess that was my first moment of power or talking too much.
Thank you. You're never talking too much. What about you, Randolph?
My advocacy has been very basic and trying to network with people about information, finding out what people do know, what people don't know, trying to have non-judgmental conversations, find out what they're interested in, just in general. I've talked to people in bars. I've met people from out of the country and have come all the way to America and come into a bar and we're having a conversation about AIDS, so that has been my approach.
Great, thank you. And finally, Keith Green, the same question.
Yeah, so I'll give two examples, one personal actually, and then one that's more community focused. So I recently fired my doctor. because of some decisions that had been made that were not necessarily in my best interest. And I think it's important, that we're our own advocates first. And oftentimes, those of us who get involved in community advocacy, we forget that, right? We allow the work to completely take over our lives, and then we don't advocate for ourselves in our day-to-day lives. And so I really wanted to share that example because it's very recent. This just happened last week. And because I think it's important that we always remember that we are our own advocates first. And so then another one is actually a work in progress, right? Advocacy is ongoing for all of us. And so for me right now, I'm really trying to leverage my voice and my power to raise awareness about the rise in methamphetamine use amongst Black, gay, and bisexual men here in this city. So those are two examples, one personal and one community focused. And for the sake of time, I won't go into much more detail, but there you go.
Well, thank you so much for that. And as someone who got his advocacy start by advocating for an issue with my doctor, because I just became HIV positive, and my doctor came in and read a bunch of numbers to me, and I had no idea what those numbers meant. I didn't know what CD4 was. I didn't know what any of that was. She didn't even look at me in the face. And then she walked out and said, "I'll see you in 3 months." And I realized that wasn't going to work for me. I needed someone that was going to walk me through this process, because as someone who was 26 years old, newly HIV positive, I needed some guidance. And so that's how I got my advocacy started. So this next question, let's get down into the real juicy stuff here. So I want to talk about why is it important to talk about HIV as a racial justice issue and not just a healthcare issue? And I'm going to start, with Chris Wade on that.
I think it's important to look at particularly care and treatment, testing people of color, Black and Indigenous people of color, particularly on this day, it is a racial justice issue. Too often, when we look at things such as the Gardner Cascade, that indicator of how folks are doing with relation to engagement in care, retention in care, and viral suppression, we're always at the end. Black folks have always been, people of color have always been left at the end. And one, it's basically built on a system that was not created for us, particularly when we look at healthcare. We also need to look at the fact that we need to engage and involve more people in the healthcare system, particularly HIV and AIDS care, from testing to care to clinical trials. They're on both sides. We need to increase that effort. Racial justice issue. It saddens me when I constantly hear reports, even currently, where today we're seeing low rates of Black and brown folks being tested for HIV. And we've got all these mechanisms that exist out there. With COVID, we've had to explore home testing. We've had to explore maybe folks going to people's houses. We've had to explore and open up to the telehealth, telemedicine opportunities that have been existing. But I think that, the racial justice aspect is we're seeing the wrong, and for too long have done nothing about it. And it's time for us as Black and brown people to take that control back, opening up our own agencies. There's that old mantra, nothing about us without us is for us. And, that is key today and holds true and resonates, I think, with a lot of us, that, we've got to get involved. We've got to take control of not only our health, but our care. And that's not just individually, but that's as a community, as a diaspora.
Thank you. Angelina, I want to ask you the same question.
Yeah, repeat your question one more time.
Yes, of course. Why is it important to talk about HIV as a racial justice issue and not just a healthcare issue?
So to answer your question, there's a couple of reasons why. So the first thing is, we're not only in this epidemic that's been going on for almost, if not over 40 years at this point, referring to the HIV epidemic, but then we're within the precipice of the COVID, Corona, whatever you want to call it, pandemic. And even before the pandemic had dawned on us, there has been many disparities when it comes to access to care, access to medical attention in Black and Brown communities. And it gets to the point where it makes it so much harder. And even sometimes it can make it so much more difficult for a Black person or a brown person or just a person of color to walk into a doctor's office, a clinic, a hospital, any kind of medical facility to receive that kind of attention, because they have to worry about traveling. They have to worry about, can they get someone who's, either the same gender or the same race, or, and just having that lack of access in our local communities definitely contributes to the lack of knowledge of whether, of what our status is, whether we've contracted anything, whether we're doing things safely, whether we're being intimate safely. And all of that still ties in with a sense of gentrification in some areas, but then there's other areas where, we're trying to hold on to because it's who we know, it's what we know, that's how we identify. But then those are the same areas that don't receive that kind of attention unless we're pushed out of the neighborhood, i.e. gentrification. So when gentrification takes place, then either we got to pony up the money or we got to get the hell out. And that's not fair, because some of the things that come into the neighborhoods that are being gentrified are things that should be available in our communities as well. So in order to even know how to process, what safer sex is, how to cure the STIs that are curable, we have to have access to this care. We have to have access to it. Without that, we're going to be walking around without that knowledge, without that information that we need to protect ourselves and to protect our loved ones. So, and that all connects with, the lack of racial equity when it comes to mind. And when we think about, do we have grocery stores? Do we have our medical facilities? Do we have this? Do we have that and the other? And I can go on about that, but I want to hear from some others as well.
Thank you. And you brought up something, what needs to happen to address the anti-Blackness practices in HIV testing, care, treatment? And I'm gonna ask that of you, Keith.
I think I actually have to go back and answer I was prepared to answer your last question.
Please.
I have to kind of go back and answer your last question in order to really get to this one. Why should we be talking about HIV as a racial justice issue? Because HIV disparities are a symptom of racial injustice, right? And so it is but a symptom, which means that, we're also talking about queer injustice. We're also talking about injustice against women, right? So, but thinking about it as a racial justice issue allows us to build alliances across issues that are also racial justice issues, right? It means that we're not in this fight alone. Our common denominator is racial injustice. So how can folks fighting for racial justice and education, for example, be our allies? How can we be strength in numbers with other folks who are fighting for racial justice and making sure that HIV is also at the front of that agenda? I hope that answered your question.
Oh, no, it definitely did answer my question. And so I'm going to put this actually to Randolph. So why is it important to create spaces for Black people when it comes to decisions being made about Black people, especially, older Black people who have like contracted HIV, if they've been, they're long-term survivors?
I need to hear you again. Give me that question again.
Sure. I said, why is it important to create spaces for Black people when it comes to decisions about Black people, in regards especially to our older LGBTQ?
Well, we need to create a space where we can develop a language where we can feel safe to talk about any aspect of it, the sexual aspect, the community aspect. I'm not too sure what the answer could be, but I think communication is the big deal with how you talk to a person, because everyone's talking. I talk to people differently up here on the north side than I would on the south side. I mean, and there's a reason for that. And the communication is I think where a lot of things break down, because you can have all these things available, but if the people don't understand what it's there for or what they can do and the advantages they can have with it, we're not going, I don't think we're going to go anywhere that fast.
Thank you.
That makes sense.
Oh, no, you made all perfect sense. So I'm actually going to move on to something else, something we kind of touched on. People often associate poverty and other health disparities as a part of the Black experience, instead of being a result of racist, economic, and capitalistic paradigms that we have here in the US. Excuse me. Chris, can you talk about why this narrative, how this narrative is used by policymakers and gatekeepers when it comes to addressing social determinants of health?
With relation to poverty?
Yes.
I think particularly policymakers, we've got to do our part. I mean, policymakers are looking at outcomes. They're looking at numbers. They're looking at, from the pundits, those people, those lobbyists that are constantly in their ear pushing agendas. Well, we've got to be in their ear pushing the agenda as well. And, if we're experiencing food deserts, if we're experiencing the inaccessible healthcare, if we're experiencing environmental issues, because when you go to Black neighborhoods, you always see factories, or those pollutants and things like that. We need to start getting into the ear of our politicians, because too often they will lean on what they're hearing and from the most people weighing in. And that doesn't mean necessarily picking up the phone and calling. It can be writing letters. It can actually be visiting their offices. I think that, too often poverty is making that association, because too often people think of poverty and the first thing they think of is people of color, being broke, always, seeking a hand up, if you will, or hand out. And I think that's where we need to get in and change that narrative, because too often, if we don't create the narrative will create it for us. Many of you have heard from our great friend, Sanford Gaylord. If you ain't at the table, you're on the menu. And that's largely what happens. We have to change that narrative and empower our own communities by having those conversations amongst ourselves, real conversations about what's happening in our lives. It's all right to be cool and, have your homies and do your thing, but every now and then we got to be real. We got to keep it real. Otherwise, our lives, the lives of our future, are all in jeopardy right now. And, when we talk about where we are with this disease, I don't think we've been honest. I mean, we look at still the Black church. Black church is a huge place where a lot of stigma is played out when it comes to us. And the first place politicians want to go to is a church. And I don't think the church is really connected to some of us the way that it should be. So recognizing some of those spaces and places where we need to be at the table is going to be critical if we want to change the narrative and create our own.
Thank you for that. And I'm going to ask you this, Brandon. The caucus does amazing work in our community. Can you talk a little bit about how the caucus work uses to empower the community to want to create that change?
Definitely. I think it goes a little bit along with what Chris said. Black people have had a history of just not being disproportionalized, and also really just not having that aid or those resources to say, hey, I see that things are going on, things around you are, stopping you from achieving your holistic health equity. So we kind of stepped in ourselves to take care of, our own. And that's one thing that the caucus definitely does. We discuss our community as in, for us, by us. That is our biggest mantra. That's how we started. That's how we're going to finish, It's like for us, by us. And we charge and, we put it, in folks to be a part that, your fight is my fight, and that the way through this is through, it's together and other stuff. So, within the Prosperity Project, within our caucus core, different elements to where things, kind of core align and they all coexist together. But it's mostly the charge of that, community is one of the ways that we've existed for a long time within different phases as Black people. So, I mean, from the early 1800s to today in 2021, we've gone through this together as a family, and that's how, the caucus bases a lot of their work.
Yes, well, thank you so much. We always hear politicians talk about and how, if people were eating better, they wouldn't get sick, or if people wouldn't have diabetes if they ate better. How, Dr. Green, how do we how do we combat that? How do we, what do we have to do to change that narrative? Because it's a narrative that's always used when Black people are suffering. It's always, well, you did it to yourself.
You Coleman, you set me up here. But I kind of hate to do this, but I have to, because I don't think I can fully answer that question without going back to a previous question, right? A question that I really like, I loved it. I love the way that it was worded, but like, I want to repeat it. People often associate poverty and other health disparities as part of the Black experience instead of being a result of the racist, economic, and capitalistic paradigm that we have here in the US, right? The racist, economic, and capitalist paradigm that we have here in the US is a part of the Black experience. Poverty is a symptom, right? We have to get back to looking at the structures that are causing these challenges within the context of our communities. How do we change the narrative? Well, I think that we continue to build upon the resilience of our people, right? We are able to be here in this space right now because of the resilience of people who have come before us, right? So no matter what's going on in this world, yes, this world is crazy. Yes, like unemployment is high, and yes, poverty, but we have come through far worse than this in this country. And so there's building upon that means that no matter what is put before us, we have the tools, the strength, the knowledge, the wisdom to move through it, to push through it. So.
Thank you for that. And yes, Black people have answers to ourselves. We know what's best for us.
Absolutely.
We do know what's best for us. So I'm gonna actually, pivot this question to Angelina. So Black and transgender men and women continue to be disproportionately impacted by HIV, but the data is often underrepresented that impact due to challenges with accurate, inclusive data. And Black trans men and women both account for more than half of all people newly diagnosed with HIV among transgender people from 2009 to 2014. Can you talk about the unique challenges that Black transgender and gender nonconforming people face right now, and how it intersects with the HIV epidemic?
Yeah, so when it comes to like the data that's collected, one of the things that I've observed over the years, and some people can probably understand where I'm coming from when I mention this, but there are research studies that we know about that we may see online or maybe referred to through a friend, and then it usually states we're seeking Black MSM, men who have sex with men, that's what MSM stands for, and trans women. Sometimes it may be categorized as individuals who are biologically male or assigned male at birth, but other times it may just say Black MSM and Black trans women. When one of the things that I mentioned this at a different event, probably about a year ago, and that is, why is it that this information about trans women are being collected, but not the trans men? I don't know of very many research studies, research initiatives that center all trans people or all non-binary individuals instead of just trans women. Are trans women impacted? Absolutely. Sex work is real, and sex work, although it's a very, 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 very valid occupation, it does come with some complications. So it is very important to know who we are and to know that we're doing things as safely as we can. But they're not taking into account that some trans men or masculine individuals or non-binary individuals may also be involved in sex work that may also be impacted by this pandemic. This epidemic. That's why it is so important to not be as exclusive when we're doing this kind of work, and to actually be as close to the ground as we possibly can, and not just rely on community to do the work for you when you're not even part of it yourself. A lot of times the people who are collecting the information also are people who are not part of the community. So they believe, oh, well, Black MSM and trans women, let's collect that information. That's easy to get. The girls want the money. The girls want to. No, that's not what this is about. This is about something so much bigger than that, because we're already disproportionately more likely to contract HIV because of the lack of access to care. But then it's even worse when you're not including all trans people or all Black people. What about Black cisgender women? So a lot of people are being excluded when it comes to studies regarding the contraction of HIV, or the levels of how easy or how much easier it gets to contract it, and the different ways of contracting HIV. So there's a lot that goes into it, but a lot of times it usually consists of leaving out a portion of the Black community just to collect data from this other portion of the Black community, and is usually collected by people who are not part of the community to begin with.
Thank you for that. Does anyone else have something to say on this topic?
I do.
Yeah.
So when I was reading the list of questions and I got to this question, I initially kind of, skimmed a little bit, like, oh, this won't be directed towards me, right? But I think that it is important that we're all thinking about this topic, that we're always mindful, regardless of how, I'm in a certain niche with my work, I'm clear about that, right? But I always have to be mindful of my transgender sisters and brothers, right? And so I had to literally go back and read that question, right? And give it some thought and be prepared to answer it, just in case it was directed towards me. It wasn't, but I think it's important that we continue to be advocates for one another in this fight, which means we have to stay informed, which means we have to pay attention, right? Because the division does not really exist. We are one community.
Mm-hmm. Agreed. And thank you for that. We are all one family, one community, and if we're leaving people out of that community, we're doing ourselves disservice.
Absolutely.
So I'm actually going to move on to, it's kind of related, but it isn't. So actually it is. HRC recorded more violent deaths of transgender and gender nonconforming people in 2020 than any year since they began tracking this violence, starting in 2013. And that number was 43. Just recently here in Chicago on December 25th, 2020, a 25-year-old Black transgender woman, Courtney Ashay Key, was murdered. And shortly after that, on January 3rd, 2021, another 23-year-old Black transgender woman, Tiana Alexander, was violently murdered. Angelina, can you talk a little bit about what is the intersectionality between this violence against trans people and HIV in our community? How are they related?
Well, one of the, first, correlations that I can think of is that some of the girls, and this is not to everyone, but this is just to some people, some of the girls may have met certain people through community, may have met, partners or love interests through community, and some may have met through sex work. Some may have met them through just popping dates. And I'm sorry, I'm going to be using some of the slang that's used in our community. And it gets to the point where there's like that sense of communication. If she's communicating saying, hey, I am positive, or hey, you need to know this before we go any deeper. And it's already a stigma as it is with a cis person dating a trans person, especially if it's a cis masculine person, and it makes no sense to me. And as much as it doesn't make sense to me, the correlation goes with the fact of if you date a trans person, you're considered as gay, and then there's still a negative correlation with that. If you're dating a trans masculine person and you're a cis woman, you're considered as a lesbian. There's a negative correlation with that. And unfortunately, we're very far away from making some serious progress with disparaging and diminishing those stigmas. And where it leads to the violence is the person may feel the way that they feel, they must be interested in this person, or they used to be interested in the person. Sometimes a person may withhold that they're trans, and that's that trans person's choice. I must repeat this. A trans person does not have to disclose their transness to a stranger. If we don't have any intention of being intimate with a person, we don't need to disclose our transness or our identity or our T to anyone if we're not going to be intimate with them. And unfortunately, some people are holding this sense of entitlement. Cis people, a lot of them are holding this sense of entitlement to that information. And this is regardless of whether they're going to be interested or want to get to know this person or want to, open up to this person. And the violence comes into play is when the stigmas play in the head, they're worried about what their friends are saying, family are saying. And it's like, oh, I don't want them to think I'm gay. I don't want them to think I'm gay. And it leads to the age-old negative connotation that comes with being LGBTQ. But it's even worse for trans people because trans women are being, 4 times as quickly murdered as any other demographic that I can think of. And especially when it's my Black trans girls. My girls, minding their own business, living their lives. And there's a lot of other stigmas that I really want to be able to dispel right now, especially the whole stigma of, oh, she's withholding information. She's not telling him her tea. She's not telling him, that she's this. If she has no plan of being intimate or being in a relationship, she doesn't have to. That's her right. That's her prerogative. Cis people have to get out of that mindset of their privilege. And a lot of people need to check their privilege at the door. And until they check their privilege at the door and actually, try to enlighten themselves with some knowledge and food for thought, we're not going to be able to make any progress when it comes to, stopping this violence against our girls, against our trans people. And there's been a lot of it, and it's still going on. I think there's already been at least 4 or 5 murders this year of trans people, Black trans women. And it's a damn shame.
Thank you. And this question goes out to Brandon. Like, how can we as a community help to break down the stigma that our trans brothers and sisters deal with every single day?
I think it's a lot what Keith and what Angelina said. It's about being together in the fight. Actually, what this whole panel is about is being together in the fight. I can think about. I'm gonna hold up a mirror to myself really quickly. I can think about my upbringing and different things growing up too. My examples of Black queerness being some older family, some different folks and stuff like that. And when transness came into the vicinity or the environment like that, it will be more so of oh honey, we don't want to complicate things. They're set aside. We're a different type, they live their lives and, we're here, we're right over here. So if anything happens, or goes on with them, honey, that's beyond your tea. You don't get into that. They live a separate life. When initially, that's just dead. No, I'm not gonna say that. That's just dead wrong. I was gonna say something else, but that's just wrong. And that is something that I can honestly say when I talk to different brothers from the caucus core or just chilling with my friends and different things like that. That was those teachings and those things, that stigma arose for all of us to in conversation. Like this is how we were just kind of brought up, to have this separation, to have this feel of they got their own thing going on, and we are, even to hear that they make it harder for us. That bothered me at a very, very young age. That's something that I've heard a lot of people say that, because, our trans sister is, outliving her life, doing her thing, that, it makes it harder on us because they think that they are gay once they are with a trans woman. That, honey, that doesn't bother, that has nothing to do with me at the end of the day. You know what I'm saying? But as her queer brother, cis, whatever, anything at all, I'm going to stand with my trans sisters, my trans brothers, and, make sure that everyone at the end of the day is safe, okay, and that we're in this together. So the stigma comes into play with that. But I want to circle back because I feel like I got far into what you were saying, but I did not answer the question for like fully. So did I get to your point?
You got to my point. You got to my point.
Oh my God.
Randolph, you got to my point. Randolph, I'm going to ask you the same thing. What can our community as a whole do to address, this transgender stigma and discrimination that lead to the violence?
I think a lot of it goes back to conversation, because you have in some communities, they don't change. You have the same stories being perpetuated and perpetuated. I go to see my own family and I see the same stuff that I saw when I was a kid. And I saw older people doing when they were, when they were in the neighborhoods. Until we can have some kind of open conversation, that safe space conversation where you can talk about anything, it's going to still perpetuate, because you still have neighborhoods that are perpetuating the same stereotypes. That's partly what I think of it. And the fact that we live in a country where we have to separate everything. We have to identify everything. But if we can be inclusive in who we are as a people, then we won't have to worry about what sex this one is, what sex that one is. It won't matter at all. But we're a long way from that.
Okay. Chris, do you have a comment to have on this topic?
Yeah, I would have to agree with the other panelists. It is standing as allies and understanding that and standing up for our trans brothers and sisters. Too often, I understand the struggle. I've got a very close friend who's making that journey, and we had a conversation, and we knew that journey would be rough as a person of color. You look at job opportunities, you look at the violence, the thing he seemed to be more aware of was, am I going to pass? And I think that in and of itself sometimes can be all too consuming, and which I think brings its own conflicts, both externally and internally. So, it is about having those conversations, but most importantly, educating in the spaces where our trans folks aren't. And that's where it really we have to carry the message.
Thank you. Since we're on the topic of violence in our community, last year we saw Black Lives Matter movement spread all over the world when the video of George Floyd murder was released. And Black people continue to be, and we know that Black people continue to be the most over-policed community in America. And as we look forward to ending the HIV epidemic, should police reform be used as a tool to address ending the HIV epidemic? And I'm going to start with you, Randolph. What do you think?
You said to address the epidemic?
Yes.
Police reform is something that needs to be studied, period. I mean, the whole reason why policemen the whole police force was established should be talked about, and they're not talking about that. Then people can better understand why they have the attitude that they have, and the fact that they could care less about trans people. We know that. If they can care less about just regular people, they can care less about anybody else. I hope I got to the point.
Yeah, I think we talk about, defund the police and moving funds around. And Dr. Keith Green, maybe you can answer this. Do you believe that when we talk about this issue, we talk about needing more funds to go to more social services in the Black community? Do you believe that police reform we should be talking about that, about HIV, into the HIV and the epidemic? Should that be a thought we should be having when we're talking about police reform?
So I'm kind of hearing your question in two different ways, right? When you think about police reform and ending the epidemic, I immediately went to criminalization, right? And it doesn't sound like that's exactly what you're talking about. It sounds like you're talking about how we manage shifting funds, policies, et cetera, around our current police infrastructure, leverage that in the fight against HIV. And if that's your question, then absolutely, the fight against HIV should be included in the conversations about how we leverage funds that we could divert from police activities, right?
Sorry about that. And now that you brought up criminalization, I'm going to kind of kick this question over to Chris Wade, who is doing great work with our HIV criminalization here in Illinois. And well, most people don't know that what the word criminalization is in Illinois. Like, what is the what can you describe to people, Chris? What is HIV criminalization, and how does it play a part in keeping the HIV epidemic going?
So HIV criminalization are basically laws that were placed on the books of states. Approximately, I think 33, 34 states currently have criminalization laws on their books. These laws were actually placed on the books, basically and imposed by the CDC back in early 1984 or 85. And they were tied with funding. So if states wanted the money from the feds, they had to buy into this, creating laws to criminalize HIV. So how this is now revealed is that through that process is what they've done is criminalize the disease, one. You know, why do we need to criminalize disease? Once we start going down that road, and many of you have probably heard of how they're wanting to basically criminalize COVID to some degrees across our nation. But one criminalizes the disease. Secondly, it begins to march how this is now because it begins to put fear in folks' heart. You can't criminalize me if I don't know my status. So the criminalization of disease is the worst part. It also creates fear amongst people getting tested and knowing their status because of the fear that someone may make an allegation after a sexual encounter. They're bad policies. Basically what they do in Illinois, and correct me if I'm wrong, Coleman, in Illinois, as I understand it, if you are using a condom, you do not have to disclose your HIV status. Now, should you choose not to use a condom, you should disclose, and it basically follows the willfulness and intentions of the person on whether or not they are willfully engaging in activities to spread HIV.
Yes, you are on the right path with that. You know, the law is so written to put a lot of the burden on the person living with HIV to prove that they shared their status, received consent, used a condom to protect themselves. Like, this is the hoops that must be jumped in order to stay safe or stay out of, without getting caught up in this law. And I ask people, you know, I'll ask you again, why should we look at HIV criminalization and do a more of a racial justice issue and not so much as a public health issue?
Well, it definitely needs to be a racial justice issue because most of the people that we know are being impacted are Black and brown communities. Most of the times, those folks that we're seeing get prosecuted are of color and largely no fault of their own. And generally, in most cases, no one contracts HIV in the process. In the cases that I'm most familiar with, there have been some, but that's very small and in between. It's a racial justice issue because we're seeing it impact desperately amongst Black and brown communities. And we tend to have sex and engage more in our communities. So of course, we're going to see the epidemic perpetuate more in our communities. But we also need to recognize that we need to get each other tested. Criminalization laws are basically, they're doing a few different things. If I can go down this rabbit hole, they're doing a few different things. One, when you get your viral loads done as a person that's living with HIV, they're doing what's called genotypic testing. So one, they're looking at your types of HIV medications that you may be resistant to. So they don't want to prescribe that. On the back end of this, back in, I believe it was 2017, the CDC began doing what's called molecular HIV surveillance. Molecular HIV surveillance is adding another piece to this, where they're actually looking at some phylogenetic data that has your DNA, and that's being reported to the CDC. So it's got your, then now they've changed the names reporting for HIV. So there's all these intersections when we talk about criminalization that aren't working for Black and brown people that we need to start addressing. We need to start either modernizing these laws or we need to start repealing these laws because they're not doing us any justice. And I say that your information is being cultivated and sent without your consent. When you generally step in to get an HIV test, you consent to that test. The true questions lie in, well, where else is my information going? Because you're told it's going to the state, but you probably didn't know a lot of it's also going to the federal government. Now, they will say that they can't prove directionality, meaning that if you are in a cluster of folks that might be having sex and HIV is happening within that cluster, they are saying that current data can't prove directionality, meaning who gave whom what. But that's for now. So I would just encourage everyone to be cognizant about this law, work towards repealing and or modernizing those laws, but most importantly, get involved. And I believe Illinois HIV Action Alliance would be the place for that. So check that out. Plug for IHAA.
Thank you for the plug. And I'm glad you brought up molecular surveillance because I was going to ask about that, how the harms or the unintended consequences that come from molecular surveillance, especially when some of our immigrants population are usually worried about this, about it being used by ICE agents because they understand our information is being put out there, or there is no consent. Excuse me. I'm actually going to move on to another question, and this one goes to you, Brandon. Last year, the Chicago Black Gay Men's Caucus released its Prosperity Project, and it was the long-term goals of this endeavor are to increase antiretroviral medication and use of HIV PrEP and HIV treatment, and move the community closer to eliminating the eliminating HIV. Can you talk a little bit more about how that came about and some of the top concerns that came out of that project?
Of course. So yeah, in beginning of 2019, the caucus went on and we did a community needs assessment to really see how the caucus should direct getting our folks to zero, and also what the community has to say about that aspect as well. So really a lot of this was to circle back to community and to say, hey, again, the whole theme of this, we are in this together. How can we get ourselves and each other to, zero? So in that, we surveyed over 200 men, 4 focus groups. We had a community town hall, and we also had a community stakeholders meeting where we discussed things with community stakeholders in Chicago. And out of those, we got a couple of social determinants of health that we know that the community put a pin in that were kind of barriers in the way for getting holistic care and to achieving that zero that we want to get to, which was employment, finances, access to healthcare, safety, income, racism, discrimination, and health concerns, which when you kind of hear those, they all intertwine in some form of facet, if not together, all. So, and I think a lot of this was things that we didn't know, but as you kind of get into the detail of the report and things, the community really got a chance to express and to talk about, these barriers in such a disdained way to just really pull out some new information and some new facts about how HIV is seen today and how we can get to zero today versus, histories done and stuff like that. And I think that for Chicago, I want to say for a study for Black gay men in Chicago, something like this has not been done in a while. I don't want to say at all, but for a while. So this is my baby. And this was a lot, it was really eye-opening to do. So yeah, that was the socials that came out of that though.
Thank you. And obviously there are definitely intersections between all the communities that we saw, all the social determinants of health that continue to drive our HIV epidemic. And sorry about that. And I was actually a part of that, a couple of the panels in the World Cafe. And I really enjoyed getting to hear a lot of personal stories from young Black queer men. And I also want to ask, the caucus does so much great work in the community. And this goes actually to you and to Randolph. Why is it so important for gay, Black, same gender loving men to feel a sense of community right now?
Randolph, would you like to go first or do you want me?
You go first.
Okay. I want to say it's important to feel that sense of community for a couple of reasons. One, I'm going to spill about me for a second. I'm from Gary, Indiana, everybody. I'm not from Chicago. So, and I have to say that some things just along the border are a little different. And just that difference alone, I encourage, just to meet new folks and to meet new things. Like we were just talking about when we were talking about the the trans issues that we face, family members were telling me, hey, trans folks is trans folks, stay out of that, and I'm just like, as a community as a whole, thinking of, the LGBTQ perspective and spectrum together, how do you make that assumption? How do you, kind of make that assumption for being from here? But once I kind of ventured into Chicago for school, I met the Chicago Black Gay Men's Caucus, and I got a chance to expand my knowledge of what Black gay men are and also who I am as a Black gay man. So I think having that opportunity to be in that space that is solidified and tailored and made for you is so essential for your ascension, but also to really bond and create a community that is for us by us, but at the same time that's growing together to, make ourselves grow and to achieve health equity, whatever that may be, supporting each other's dreams. That's something that we do all the time as well. Like, different things like that, I think is super important to have in those spaces when you are cultivating spaces for Black queer men. So yeah, go ahead, Randolph. I'm sorry.
Interesting thought, because I was wondering if the older generation has a different view on what community is than the younger generation. I participated in, I live in Town Hall here on Halsted, and we participate in intergenerational dinners and things where we actually talk and find out what the younger people are interested in, and they find out what we're interested in. And that sense of communication was really nice because you can share the information. If you're not talking to each other, there's no bridge, and we're not going to get anywhere. Just having that conversation with a kid that was 19 years old, and he met one of the tenants here who is also an artist and designer, and just watching the conversation that they had and all the things that they have in common. We'll find out that we have more in common than we think we do. And age doesn't really separate us that much, except physically, But the sense of community, I wonder if there's a difference in what people really think is a sense of community, because we're not talking. I don't even see the gay community really talking to each other and as a whole. They talk for what they want out of each other, and it's different. I came up differently in the in the gay world where there was a little bit of mystique. Now it's all taken for granted. So what do you have to say, or what can you say that's going to make anything better?
If I could piggyback off. Oh, I'm sorry, Randolph. I just want to piggyback off of you really quick. When you speak about similarities, I think, having intergenerational conversations are super key and super important. I think in all facets of intersection and different things like that, you do pull out so many similarities from just talking and being able to be, fellowship with one another. But I think also what worked and I've also seen to be prosperous was really also inviting the similarities along with the differences. Because when you experience those similarities and differences, the differences really cultivate change. And you really get down to different roots of, causes or why do we feel this way? Or why has this been said? Why do we feel like, bisexual folks have been left behind, as well as our trans community and different things like that. We invite those differences in as well as those similarities. And that's where a lot of the ground gets to shaking. And that's what I like to see sometimes. So just to piggyback off that too, but it needs to happen a lot more.
It does.
The conversation with transgender. A lot of people have no idea what transgender people go through. And there are certain stigmas that people do have about transgender people. And there are some what are those falsehoods that they believe in. Until we have these conversations and can actually sit down and say these things like you were saying, Brandon, how you feel about something or what you're thinking about, and the fact that you can be different than someone else, it just gets stagnant. And
Angelina, do you believe that we as a community, as gay, sim, gender-loving men, and all of us, do we need to do a better job of communicating and understanding ourselves?
Definitely. I think definitely. I found so many things about myself that I didn't realize because of someone that I met from Sri Lanka explained something to me, and I was like, really? And it changed my whole facet of how I thought about what I was doing and with my life.
So I actually agree that there should be a much better job that should be done with overall communication. Although there's so many different layers to communication between the LGBT community and the TQ, and sometimes just the T, there's just so many levels of just discourse and so many levels of just conflict that has been unspoken for decades, whether it's surrounding HIV and how it's and how one transmits it and how it's passed on, to what the distinctions are between the trans community and the LGBT community, whether it's who's more sickening, which doesn't even matter because we're all sickening in our own special way, we're all amazing in our own special way, whether it's, oh, I don't understand what this is, you know, what is trans, how's that different, I thought it was the same as LGBT, when in reality we know, or some of us should know, but for those who don't know, allow me to spit some science. So LGB would be more of a who you go to bed with. Being trans is who you go to bed as. And until the masses understand the distinctions as far as that among many, then the communication lines will always remain closed. And then more importantly, we have to sit in our own stigmas that we hold against one another in order to have those real conversations. We need to figure out, why is there such strife between gay men and trans women? Why is there strife between lesbians and trans men? Why there's so many issues between the LGBT community and non-binary community members? Why? Why can't people be themselves? So when it really comes down to communication, it has to start with owning our own role within the conflict, accepting full accountability, and not having to point the finger back at someone else and saying, but you did this and that's why I didn't know. You need to own yours. Yeah. Own yours. That's the only way that you can grow. This is the only way that you can evolve. You can only evolve when you learn, and you got to open up your mind and open up your ears and close your mouth. And then you must know and listen to someone else's perspective.
Thank you. Thank you for that. Yes. Being able to listen, take in information, let it sit with you for a little bit can be hard sometimes for people, but it's what's needed if we want to move forward. Thank you for that. So I'm actually asking another, another question. And this kind of goes to Randolph, as someone who is, an older gentleman who has been living with HIV for a while. Can you talk sometimes about how the older LGBTQ people are sometimes left out of conversations or pushed out of conversations, and some of the issues they have around housing issues and different needs that you have outside of different needs that our younger generation have?
Well, just in our society as a whole, older people are just pushed to the side. But I also feel that as an older person, we should know better and we should make a place for ourselves. We should also make a place where we can open up to having these conversations with younger people. Living in this building is nicer than it would be probably with a lot of other things, because we have a lot of things, they treat us a certain way because it's one of those premier buildings or sort of thing. But then you still don't see family members. You don't have family members coming to talk about anything that much. You don't see a lot of friends come here either. So I'm wondering, and it is a mixed building with gay, straight, everything, We got everything in this building, but there's the lack of communication. There's the feeling that I have been online, have been told, why are you online? You should be dead by now, by someone younger. I don't understand why they would do that to someone older or to anybody, period. But it's like, it's just poor communication is going on. And we have a problem with being inclusive. I think that's all these separations and descriptions, it just causes confusion. We're all human beings. It doesn't matter what sex you are, unless you're a person, like you were saying earlier, personal. You're getting to know someone personally. In terms of being older and gay, I don't really feel like we have a place as older people yet. But then again, I don't think we've tried to make our place. We have to do just as much as the younger people making their own places, but we have to do the same thing. And I guess we've gotten used to being kicked to the wayside for so long, it's just accepted. I hope I answered some of your questions.
And I also ask, why is it also important for, older LGBTQ, older just Black people to be at the table when we're talking about advocacy? Because so many times people want more younger people to join advocacy and they just kind of leave out older people as if they do not have anything to advocate for.
It's the sharing of information, the experiences. I mean, there may be some experiences the older person had that a young person hasn't had yet. And because of the sharing of the experience in itself, it could add on to something that they may think of for themselves as they get older, because most of us will get older. And yes, we should be at the table. All of us, it should be a mixture at the table so we can get so many different viewpoints and have a better, broader understanding of what's going on in our community. I think we're pretty much isolated. You have the trans here, you have your straight here, your gay here. And, I don't know. I don't know what to say about how to deal with the elderly thing, because it's just been like that with the country, period. We don't revere our elderly in this country. Yeah.
I'm gonna jump in because he talked about elderly.
Older.
Randolph, come on, brother. I just want to say, well, I think you really resonated with me when you talked about the history that we bring about this disease and how we were treated early on. Not to mention the number of brothers and sisters that we've seen die from the physical manifestations of this disease that were different from our white counterparts early on. And we bring the personal stories that can really resonate at the table a lot of the time. So Randolph, thank you for that. And that just really resonated with me. But I'm gonna have to say, I'm a part of that group. So
you're part of the WISE group. You're wise with age and information. We talk about history, and Black people have always been kind of written out of the history of HIV. We're always kind of written out as not being a part of it, not being there as advocates. We look at the Stonewall. There's always a whitewashing of our history. And why is it important to fight for our stories to be told so that we can still we're not erased from history? Because we do know the winners write the history books, but why is it important for us to fight and advocate for our own history and to stand in that? Angelina?
How did I know you're going to choose me first?
I mean, you were smiling and I was like, you know what?
Well, I'm glad you did choose me first for this question, because to answer that question directly and as simply as possible, the reason why it's so important to hold on to that history and to preserve that history is because we must avoid repeating history.
Yes.
We must learn from it in order to not relive it. We must learn for it to understand what the pathologies are that are so harming, harmful and traumatizing, so that we can break those pathologies. We don't want to relive the things that our great grandparents and beyond have experienced as slaves, or as, you know, someone who have lived through the earlier days of Jim Crow. So, and one of the things that is definitely a dying art for the most part is storytelling. Storytelling was so big in our community, and in ways it is still big, but not as much. And one of the reasons is because there's this division between younger people and our wiser generation, those who are, you know, 50 and up, 60 and up. And if the young people would just sit down somewhere and listen and shut up and listen to somebody, and if the older people can sit down and actually share some of the juicy gossip, you know, we love to hear some good stories from back in the day, and don't be leaving out a single detail, we can learn something. We all can ensure that we don't lose our identity through the lack of communication. But it all starts with older people being willing to share and communicate, because the generation prior to the baby boomers were also known as the silent generation. And words can be more true than that. My grandmother, God rest her soul, she was a very silent person. But whenever she had something to say, she said it. But outside of that, she was pretty, you know, observant, just like me. So, and I get a lot of that. So if we can give the floor to those who have lived longer, who have experienced more, and actually listen and actually take in what they're saying and not dispel those experiences, we will have a much better chance of not repeating history. We have a much better chance of knowing what things were like back in, you know, the 70s, the 80s, as far as the beginning of the HIV epidemic, how the criminalization has culminated in the ways that it has, and to try to understand some of the things that we're experiencing today, such as, why is it that if you are a man who has sex with another man, you are unable to donate plasma? Why were these laws set into place so many years ago? And why is this law still set in place today? Why is it that this? Why is it that that? And someone who lived through that time when it was established can give more insight than someone who is just living it today and just says, oh, it's just what it is. But on both sides, communication needs to improve significantly in order for us to not repeat history, in order for us to not descend upon a precipice of disaster. So I could say more about that, but one of the things we got to start dispelling first is ageism. Ageism is real. It's already bad enough, and no offense to the other panelists here, but it's even worse for women than it is for men. We got to be honest here. Although ageism is bad for all people that's over a certain threshold in life, it's worse for women because a lot of times it starts at an earlier point than it does for men. So ageism has to be dispelled, but we all have to admit that we need to do a lot better with communication. We need to communicate with our younger folk. We need to communicate with our older folk. We need to actually listen to what these people have to say. That's why I take personal joy out of communicating with it, you know, with my older relatives. They have a lot of great stories to tell. And, you know, we can learn so much, so many valuable lessons from it.
Thank you. And we lost a whole generation of people through the AIDS epidemic, you know, and so the stories we do have are very important. And Keith, I want to ask you the same question, you know, what can we do? Why is it important for us to make sure our history is not overwritten or left or whitewashed?
Yeah, so first of all, I want to say thank you for inviting me to be a part of the discussion. I do have a hard stop at 6:30 because I have a class in a little bit, so I have to get myself ready for my class. But I think it goes back to, you know, what we talked about earlier, and that is resilience. We are able to glean resilience from our stories, from our history, from knowing how we overcame, right? So yes, as Angelina was saying, right, we don't want to repeat the same lessons or have to repeat the same mistakes over and over again. But we also can certainly gain strength, courage, and wisdom. I've been on an NDRE kick over the past couple of weeks for some reason, but strength, courage, and wisdom from those stories. So if we are not narrating the stories, that part of it gets deflated, right? It is not as powerful as it would be if we were telling that story. So it's important that we do that so that those who are coming behind us can gain strength from it and move forward. And I'm on for it another 5 minutes, and then I'm going to jump off. But thank you all. It's been a pleasure.
Thank you. We're about to wrap up right now. So I think I want to thank you all for being a part of this conversation. It was a very fruitful conversation. I enjoyed every second of it. I also want to thank everyone who is watching and was a part of this. This conversation does not end here. The movement needs you to stay engaged and active. And one of the best ways to stay engaged and active is to join our Illinois Alliance for Sound AIDS Policy. It is activists that mobilize their communities in the hopes of creating equity and justice for people living with HIV and vulnerable to HIV and also related chronic conditions. So if advocacy is a passion of yours, if you heard something tonight that made you want to kind of take the next steps with advocacy, or you just want to find something you want to advocate or be empowered, please become a member of Illinois ASAP. You can contact me. I think my information is going to be put in the channel. It should be, yeah, there it is. So thank you all for joining us and have a great rest of your evening.
Oh, thank you. I didn't realize that was the end. Good night, everyone. Good to see you all.